Facilities that make this program possible are provided by the City of Highland Park. Programs are produced independently by members of the community. The City of Highland Park is not affiliated with the following program or the producers of public access programming and is not responsible for the content. The following program does not reflect the opinions of the City of Highland Park.
Welcome to Chill Out. I'm Pam Chill. I'm one of the Highland Park senior producers, and today's program is about the new options that we have in health insurance. I'm privileged to have as my guest today Rebecca Bloomfield. Welcome, Rebecca, to the program.
Thank you,
Thank you so much for appearing.
For having me.
Okay, we have a very, very agenda in front of us. Because as we tape, I do want to say it is October the 9th. And coming up is the open enrollment, which I know is an integral part of what you do. So again, welcome, Rebecca. I'm going to give you a brief introduction. Rebecca Bloomfield is a partner in Jerry S. Pearlstein Insurance in more ways than one. She and Jerry are married, and I've had the opportunity to meet your wonderful husband. And they have a unique insurance agency that specializes in taking care of independent business people who must buy their own health, disability, life, and long-term care insurance. So, you started your first business at age 11.
I did.
I read that and I was, okay, very entrepreneurial at a young age in the world of writing, acting, theater, radio, and television, which is a medium we are now doing today.
That's right.
Corporate life, Leo Burnett, International Advertising Agency, and you work as Creative Vice President. You created and performed plays about women in American history around the United States and the United Kingdom. You performed at the White House, portrayed Abigail Adams during the 200th anniversary of Congress, and the President taking residence in Washington, D.C. You were the founder for a non-for-profit Bright Star Learning Cooperative. The purpose was to show teachers how to incorporate the arts into teaching core curriculum and how to grade to meet state and federal standards. And then in 2002, you founded Jerry S. Pearlstein Insurance with your husband, Jerry Pearlstein, to serve the independent arts community, now serving entrepreneurs, sole practitioners in all endeavors.
Right. Thank you.
Wow, that is quite a bio, yes. From theater to advertising to insurance. So, yes.
Right.
So, how did you and your husband start the agency?
Well, as I said, we were in a world as a creative person with Leo Burnett. When I left Burnett, I was still part of the world that acts, does music, paints, does scenery, does makeup. All these people needed health insurance. And I thought, leaving corporate life, that it would be easy to get it, but all I heard were horror stories. And then we really started, I had a partner, Robin Bennett, a wonderful creative woman who was a teacher in the not-for-profit that we created. And unfortunately, several years in, she developed breast cancer, and she had no insurance. We were part of that creative world, and so she had to leave what we were doing and join the public school system. She became curriculum development at a new Jones college prep high school that was humanities-based, and their theater department, but she couldn't do what she wanted to do with us because she needed health insurance. And that was another call to say, we've got to help our own people take this step into how you find health insurance. Someone has to be the go-to person, the expert who can help them. And from creatives, then a whole world of entrepreneurs opened up.
Oh, right. One, led to another, and right.
That's
absolutely.
right.
So tell me about your involvement in the creative community
Well, I started
and the
out.
business world.
I started out even as a child doing theater and television and freelance writing. And I wrote The Magic Door for WBBM TV. And then I moved into advertising, which I loved dearly. And when it was time to leave that, I read a biography about Abigail Adams.
Now, why Abigail Adams?
Well, Abigail Adams had a time in her life. John was at the Second Continental Congress in 1775, and Abigail is home with 4 children, and her mother dies, and she starts to wonder what kind of woman she should be, where a woman should be. Her mother was the wife of a minister, a good Christian woman, and Abigail is much more opinionated, much more widely read, and she wants to be in Philadelphia to be upon the stage of action there myself. But the minister said a woman's body gives purpose to her life, not her mind. And she really writes in her journal, that can't be true. God gave me a mind the way He gave me.
This is kind of the beginning of the forefront of the women's right to vote movement.
In 1775. And that's exactly what it seemed to me. I'd been a working mother all my life trying to balance those things. And here it wasn't new at all. It started with our country. So that's why I became enamored of her.
She was kind of trailblazer, right?
Yes.
Doing that. Now, what happened with the play?
I really wanted to perform it and then license it out, but we were asked to come to Edinburgh to the Fringe Festival, and we got great reviews, and when I came back, I got an agent, and I toured here in England and Scotland, and the National Park Service, the Quincy home, had helped me develop it, and then they booked the play out. And then I got a call from the White House. And when you go to the White House, you're in the East Room. You may have seen things on PBS, and you get 20 minutes. And I was there twice. And then I was chosen to represent. Abigail Adams was really the first lady to live in the President's house in Washington, D.C. It was finished. And that 200th anniversary of that was in 2000, and I was asked to spend 4 days being Abigail Adams during all those ceremonies.
Oh, you know what? I heard about that, and it was you.
That's right. That's right.
That is quite an accomplishment and recognition. Yes. And who was the president then? Was
John Adams was her husband. Was the president.
But when we did it for 2000,
Clinton.
Was,
well, it was an interesting time because that was the time when was Gore going to be president, or was Bush going to be president?
Well, obviously we know Bush became president, right? Yes.
So I met with President and Mrs. Clinton the first time I performed.
Oh, okay.
But at that time, they weren't in Washington, D.C. They were waiting for the results elsewhere.
Oh.
Yeah.
Alrighty, very interesting. So tell me about, why did you leave the world of insurance? Were you with Robin Bennett? Well, actually, it wasn't insurance, but it was more the advertising world, right?
No, well, I was in the advertising world, and things come to an end. Right. And then I had this opportunity with Robin to do this not-for-profit. I'm a firm believer that theater in the schools is a way for kids to experience American entrepreneurism. You start with an idea, you get people together to bring it to fruition, you create a product, you bring it to the public, and then you do it, and you get enough money to do it again. So to foster that, since the arts programs were being cut, we started this not-for-profit, but then Robin got breast cancer and had to have a mastectomy and couldn't continue with me. And then again, it was like the second time again the community needs help. Somebody has to be the expert, a go-to person to help them get the information
to
they
navigate.
need. Yes.
It's very, very tricky, very complicated.
And has only gotten more so.
So how did you get started?
Well, we had mentors, fortunately, in the insurance business who were both on the property casualty side and on the life insurance side. But they looked to mentoring us because they didn't like to do health insurance. They didn't want to do that, so we did. So that's how we got started, and it took off very quickly. There was a need, and we were there.
Absolutely. Now, you said you did start with your husband the agency in 2002. What changes have you seen since the time that you got into the field?
So the first dozen years, we were under a system where health insurance companies, providers, could decline you coverage if you had a medical history. The application was 17 pages long to take all your history of everybody on it. And then the Affordable Care Act changed that. And in the establishment of the Affordable Care Act, we have now seen insurance companies who have opted out of offering Affordable Care Act compliant health insurance. We've seen changes in affiliations with hospitals and doctors and insurance companies. We've seen the ability to help people pay premiums come into play. And we now, in 2019, there are some new options, and one of the new options has to do with the fact that it looks like things are stable for a year. This is good.
That's very good. Well, let's talk a little bit about the changes that are happening in 2019. And so tell me about,
we have a triple enrollment period coming up. Starting October 15th, a few days after this taping, we will start a Medicare open enrollment. And I know you're familiar with this. There are several reasons why you should pay attention if you're on Medicare. One is if you are in a Medicare Advantage plan and your doctors or hospitals aren't covered, perhaps you want to look at going to Original Medicare. If you are in Original Medicare and your supplement isn't working for you, this is the time to change your supplement. If you have a drug plan, Part D, for your prescriptions, your provider has just now sent you a letter saying these are the changes for next year. If you don't like the changes, this is the time to make those changes. I'd also like to say there has been a rumor that a standard F supplement policy is going away this year. It is not. It will be here all the way through 2019. So it's one of the, we like that policy. It goes everywhere. It does everything.
Right. So we talk a little bit about the managed care programs where you need a referral for everything.
Well, that's in your Medicare Advantage.
Advantage, right.
That's in your Medicare Advantage. Those are whole programs. It's like a health maintenance organization for people over 65. And the doctors can opt out. They can choose not to take a Medicare Advantage card. The number of beds in places has shrunk for people who take Medicare and Medicare Advantage. That's the choice, the private choice to the public program. There's not much that we can do about it except to be aware of what's going on. And if you are turning 65, then this is the time to talk to your doctor and say, what do you take? Do you take Medicare Advantage? Do you take Medicare with a Medicare supplement? Those are your two choices, a total program of Medicare Advantage and Medicare with a Medicare supplement. On the Medicare supplement side, everybody who takes insurance takes Medicare. Doctors give a plan of care. As long as there's a plan of care and Medicare will pay for it, the supplement will pick up. Because Medicare is an 80-20 plan. It's health insurance. And it's an 80-20 plan, with no maximum out of pocket and no point at which the government is ever going to pay 100%, whether you're in a Medicare Advantage plan or you're in a Medicare and Medicare
And you have to meet
supplement
your
plan.
yearly deductible as well.
That's right, and there are deductibles, exactly. Exactly.
Absolutely. So what are the advantages of using as yourself an agent to navigate the process?
Because of the misunderstandings, our young people like to go online and get it done. Right now in Illinois, in our area, for people under 65, there are only 3 providers of the insurance. 2 of them don't offer insurance outside of Cook County, and Blue Cross is the only one that's providing in every county in Illinois. But if you've been in a group and employed, you have a card that will take you to all the hospitals in the area. But that's not so for individuals and families right now buying their own insurance. You have no access at all for an Affordable Care Act compliant plan to the University of Chicago or to Rush University. So how do you know how to get the card that will actually pay the doctors and the hospitals that you want to go to? And unfortunately, going to the government or going online, they have no idea of the local situation here. Their purpose, they are trained to tell you the lowest premium. But whether you're paying a premium on a card that will actually cover where your doctors and hospitals are, they don't know. And so that's why you need somebody who is accredited. We finished our accreditation on August 31st for the 2019 season. We have a national producer number. We are licensed in the state and with every provider that we can help you with.
Alrighty, very good. And what if you have people who are snowbirds? And I did want to ask you that question. So what happens then if they're in type of an Advantage plan where they're...
Yeah, that may be a problem if you're an Advantage plan. It doesn't travel as well as original Medicare and a supplement does.
Right, it's something to look into if you are going to be away for the 4 months that you are.
Right.
I see you won numerous awards. I just wanted to kind of like show you.
Yeah, we are
you're very proud of that.
I'm very proud of this. This is from healthcare.gov. The elite means that we have brought in 2018, between 100 and 500 people to the government because the government has a program of premium assistance. We've helped people get premium assistance when they are in transition. People get premium assistance if they are a small business person and by the time they finish paying their business expenses, their adjusted gross household income makes them eligible for assistance paying premium and assistance paying cost sharing of deductibles and out-of-pocket maximums. And people who are in part-time work, whose income, they don't get benefits from their companies, and their income makes them eligible. So we're proud to have this. And if I may, I'd just like to read the sentence that has made me so happy. It says, "Thanks to your hard work, you have increased access to health care and made a lasting positive impact on your community." And it makes us very proud to have received this award.
Oh, yes, absolutely. You do a lot of great work. I mean, it's very beneficial that you're guiding people through this whole process, which is so complicated, and, actually saving them some money so they're not spending their entire paycheck on health care, which I did want to go into briefly about premiums. I want to discuss a little bit about that. If they're under the 65, they're not, at the Medicare level, but their deductible is tremendous.
Yeah, that's what's
Thousands.
happened. Complying with the Affordable Care Act for private companies having to take everybody, not being able to decline everybody, having to remove limits from claims. There are no limits on Affordable Care Act insurance as to claims or lifetime claims. And having to include a level of benefits for emotional and mental health, chronic care, maternity that they didn't have to provide before has raised the premiums. I must say that this year, for the first time in 5 years, we believe that premiums will not be going up 16% the way they did. We believe that Blue Cross will be stable and that the other two providers will be more reasonable in their increase in premiums.
Now, going back to the using your insurance, a lot of people get denials. They want a procedure done, and it's denial on medication, it's denial on the procedure.
Not for Affordable Care Act insurance. It's possible you do need a plan of care for Medicare over 65. We're switching now to over 65. You do need approval on your plan of care in order for Medicare to sign off and say that they will give benefits. And it is more usual that someone with a Medicare plan and a Medicare supplement can immediately get help than a Medicare Advantage. You may have to wait a little longer on a Medicare Advantage plan.
Very good. I just wanted to briefly, I just got this in the mail, and this is from ARP, your Medicare checklist. And all the things, made the best coverage choices during open enrollment. You should make them by answering these 15 simple questions. So we'll do this very briefly. Okay, 1, do you want to keep your doctors, which we discussed, which is very, very important because, they may or may not be on the plan.
Right.
And 2, do you have pre-existing conditions?
Well, that goes to where your treatment is, and if you want to stay. Medicare cannot decline you coverage. If you have paid in your 40 quarters, you are and turning 65, you are eligible for Medicare. But the doctors that you are using, there's a distinction in perhaps whether they're taking a Medicare plan with a supplement, which is called Original Medicare with supplement, or they're taking a Medicare Advantage plan.
Right. Okay, 3, are you taking medications regularly? That goes into the Part D prescription plan.
Yes, and I want to say to everybody out there, I'm a healthy person, and I wasn't going to sign up for Part D because I don't have prescriptions, but there's a penalty, and the penalty stays with you forever if you don't sign up for
I did not know that.
Medicare Part D.
Alrighty, very good. And 4, would you change pharmacies to save money?
Well, again, those change often with your plan and who's a favored pharmacy and who is not. And that's one of the things that if you're on Part D now, they don't ignore it. They've sent you and said these are changes in your plan, and they may include a change in what pharmacies are giving you the best price.
Okay, number 5, do you have health insurance through or your spouse's job, through your job or your spouse's?
Yes, if you're over 65, you don't have to go to Medicare right away, but you have to have what they call credible coverage. So if you're still working, and many of us over 65 still are, and the company has a group plan and they'll keep you in the group plan, that's credible coverage, and if you have through your spouse. But as soon as you lose that or leave that, you must apply for Medicare.
Okay, number 6, do you get your insurance through the Affordable Care Act, which is known as ACA?
Well, that would be if you're transitioning from under 65 to over 65.
Right. Okay, 7, are you covered by COBRA, which we touched on that just briefly?
Right. Now, the interesting thing is COBRA is not credible coverage. So if you've lost your job and you're 65, you must go directly to Medicare. Don't wait.
Interesting. Very good. And it says once your employment or employee's coverage ends, you have 8 months to sign up for Medicare or with penalties.
Right.
Same thing. Okay, 8, do you have retiree health insurance?
Well, that would be from your company. Perhaps they early retired. You know, people getting offered early retirement and they go into a retirement plan.
Right.
And you have to check with your retirement plan as to whether that's credible coverage.
Okay, and then 9 pertains to 8. Are you eligible for retiree coverage from the military's TRICARE for Life program?
Right.
Right. Okay.
And you should check if you've been there are programs for veterans. You should check with the Veterans Administration about what's available to you in monies and insurance.
Number 10, have you planned for monthly premiums?
Right. That's part of your financial planning. That should start as soon as, like in your 30s. I know 30-year-olds don't want to think about it, but that's
I know
what we
you don't
have.
want to think about it, but you have to do that.
You have to do that.
Right, and they're talking about the Medicare Advantage and the original Medicare.
Mm-hmm.
You know, can you come up with all the premiums or the 20%
Right.
that's allotted, you know, plus your prescription plan, which is another plan.
Right.
Are you eligible for Medicaid?
Well, that would be, let me say that the being eligible for Medicaid is in a way different than getting assistance for Affordable Care Act insurance. So Affordable Care Act premium assistance is based on poverty levels, but it doesn't take into account your assets or what's in your bank account. It only takes in your adjusted gross household income. But going to Medicaid, if you're on Medicare, does. It's very complex, and it includes your assets, what's in your bank account, as well as your income.
Right, and then there's a limited amount of physicians that do take Medicaid
That's
as well.
right.
Medicare, Medicaid.
That's right.
And then we have number 12, need financial help. So
there is, for seniors, this is for seniors, a wonderful organization called the Senior Health Insurance Plan. And it's called SHIP, S-H-I-P. And you can Google SHIP, and there are people like us who help people like us navigate through this.
Absolutely.
Not for profit.
Right, very good. That's good to know. 13, do you live in a rural area?
Well,
I guess that makes a difference as far as hospitals and physicians,
It does.
right?
The choices, doctors in those areas understand that there are fewer choices, and they're more apt to accept Medicare Advantage than in an urban setting where doctors have a greater population to get a client base from.
And you travel internationally.
Right. Medicare does not travel internationally.
Now, does your secondary travel internationally?
No, because the secondary only comes into place when
When Medicare kicks in. So in other words, you're on your own, and you would have to buy your own travel insurance.
That's right, and there is global travel insurance for a one-time trip or to buy it for the whole year wherever you want to go.
Depending on where you're going.
But
right.
Medicare and original Medicare with a supplement really goes everywhere. We've seen it used at Cleveland Clinic, Mayo Clinic, in Florida and Arizona, California. It goes everywhere. The Medicare Advantages may not.
Right. That's also, good to know. I mean, when you're making your decision. And 15, we talked about it briefly, do you have a second home? You know, because you have to make sure your medical advantage would cover when you are out of state in that period.
That's right.
So,
those are
so
good questions.
much information to take into account.
Can we just go over what's happening now
Sure.
then?
We have a brief, I think we have about 1 more minute, but
Good.
that's all yours.
So
You're at the floor.
October
Thank you.
15th to December 7th, Medicare enrollment, all those questions we asked about, what's working, what isn't, now's the time to think about it and change. November 1st to December 15th, time to re-sign up for 2019. Your plan might roll over, your ACA plan. It might not. If you want to make changes, now's the time to make them for 2019. If you have assistance now, you must go back and re-up that assistance. That's the kind of work that we do with the government for 2019. And then we have more people going to very small groups, 1 and 2 person groups, partnerships for health insurance. There's a special enrollment period for that. Same enrollment, November 1st to December 15th, and we're helping more and more people who are self-employed, who are entrepreneurs, to go that route.
Well, thank you so much, Rebecca Bloomfield, for navigating the entire process of new options in health insurance.
Thank you for having me, Pam.
Thank you very much. We've got a long road ahead of us. All righty.